Hello, we are in Ethiopian capital Addis Ababa to tell the success story of a mutual cooperation health sector between the Republic of South Sudan and the Federal Democratic Republic of Ethiopia. In this program, we will strive to narrate the genesis and the strides made in the process of training and building the capacity of South Sudanese medical doctors in different Ethiopian institutions of higher learning at a tuition-free program that aims to collectively raise the standard of the regional health sector. Since the start of this program in the year 2015, a total of 140 doctors from South Sudan have been enrolled at a specialized training in different Ethiopian medical schools. So far, 36 have completed their studies and have returned home to support the country's health sector with their newly acquired expertise. To explicitly tell this story, we will be talking to senior health officials from Ethiopian Federal Ministry of Health, professors and doctors at the Black Lion and St. Paul hospitals in Addis Ababa, and interview the South Sudan ambassador to Ethiopia, as well as concerned health officials and stakeholders from South Sudan who played a key role in making this program a success. Stay tuned. A program started as a discussion between two individuals in 2015 with an aim of establishing lines of communication and cooperations in health sector, quickly turned into a scholarship program offered by Ethiopian Federal Ministry of Health to train and build the capacity of South Sudanese doctors at different institutions of higher learning across Ethiopia on a yearly basis. The residence program provides an opportunity for South Sudanese doctors to further their education through a generous scholarship program offered by Ethiopian government with waived fees for the applicants. To understand better, we sampled the chronological series and testimonials of the beneficiaries and providers of this noble program.
First of all, we want to say thank you to Ethiopian government and the people for giving us this opportunity for the people of South Sudan to get this education opportunity, especially in capacity building in various areas. It is, in fact, a very wide area here that Ethiopia has taken it upon itself to train and to educate and to do many things.
Let me start by sincerely thanking the Federal Ministry of Health of Ethiopia for supporting South Sudan. They have been consistently supporting us in developing human resource for health, because human resource for health is foundation. Without qualified human resource for health, even if you have all the buildings, even if you have all the technology, even if you have all the equipments and you don't have people who know what to do with it, those will be meaningless. And so Ethiopia is helping us. And so through this program, let me sincerely thank the Federal Ministry of Health of Ethiopia, the people of Ethiopia for supporting South Sudan. Indeed, Ethiopia has been supporting us. Like our president put it recently during the inauguration of His Excellency Prime Minister Abiy Ahmed, our president said, and I wanted to quote what he had to say, he said that Ethiopia is our mother. So indeed, Ethiopia is our mother.
There are different collaboration areas that Ethiopia and South Sudan conducting together. So one of the areas we are conducting is giving training for the medical specialization training of South Sudan fellows. The training actually started in 2015, but when the training began, there were some challenges from our side too, because the number of opportunities given to South Sudan medical students were few, but through time we were able to increase the number of quota. So starting from 2050, I think we were able to receive more than 140 students.
We started this program in 2015 when, at that epoch, Dr. Amir Aman was the minister. So it was a bilateral agreement between South Sudan and Ethiopia, mainly because to reach the HRH acceptable level of medical doctors in the population. And as you know, WHO's standard is 1 for 10,000 per 10,000 inhabitants. So as you know, new country, young country, where infrastructures and human resources very pivotal for betterment of healthcare service and with an equitable way. Delegates from South Sudan came and discussed how we can improve the healthcare system in South Sudan. So basically, at that time, we said, okay, let's take a good number of medical doctors, graduates, undergraduates, and then put them in a residency program.
Without any doubt, this is a very important program because every country, for it to move forward and develop, they need to develop their human resource. This initiative is a noble one, and I believe the government of Ethiopia has continued in its promise to support their brother in South Sudan. Without doubt, Ethiopia has done a lot for our country, and I can relate it back to some of the capacity enhancement programs that it has been having over the years.
It's really a pleasure to thank the Ethiopian government for this collaboration, because it has been a while since this program started, and now we have over 30 specialists who graduated from Ethiopia, and currently they are working in South Sudan in different capacities, not only in obstetrics and gynecology. We have surgeons, we have orthopedic surgeons, we have physicians, we have pediatricians, and we have radiologists and the other specializations. And it was out of the generosity of the Ethiopian government availing these chances for the South Sudanese who are stuck for quite a long period of time without specialization in the country. And they managed to go with this program and succeed. And the rest are also still there now pursuing their postgraduate studies. And this is a great opportunity for the South Sudanese who have joined and finished the program. And it's also a great opportunity for those who are still doing it. And it's also a great opportunity for those who are coming to pursue this study. So with this message, I would like to thank the Ethiopian government for the great role they have done.
My name is Dr. Kwad Mabior. I'm an orthopedics and trauma surgeon working currently at Juba Teaching Hospital. I'm a graduate from Mekelle University, Ethiopia, class of 2020. I would like to thank the Ethiopian government for the opportunity that they gave us to pursue our postgraduate studies in Ethiopia. It was really challenging in the beginning, but we managed to tackle all these challenges until we finished and we came back to the country.
My name is Dr. Rajawin Antonio Ajak. I'm consultant of internal medicine, and I'm working in Juba Teaching Hospitals, and I'm also assistant professor in Upper Nile University College of Medicine. I did my postgraduate study from Ethiopia. I finished in 2019.
My name is Dr. Gumarial Chano. I'm here doing gerosurgery, and with me are my two colleagues, Dr. Jiang Atian, also doing gerosurgery, and Dr. Yak Jurkuch, who is also doing gerosurgery. We came here in 2019 for our residency program. We were a total of 30 students. By the program that was sponsored by the Ethiopian Federal Ministry of Health and the Ministry of Higher Education. And we would like to pass our message of gratitude to the Ethiopian Federal Ministry of Health for the chance that they have given us in order to pursue our studies here in Ethiopia, and in order to make sure that we go and help our country, go and improve the health system in our country. And as for our country, we will also like to appreciate the former Minister of Health, Dr. Ria Gaikok, and the current Minister of Health also, Dr. Ms. Achwe, for the chance that they have been offering and the support that they are continuing to give us.
Hi, my name is Acheng Yagdao. I'm doing pediatric and child health care at Addis Ababa University.
Hi, I'm Dr. Suzy Sokiri. I'm doing pediatric and child health care at Addis Ababa University.
Hi, I'm Abak Rafael, and I'm doing emergency medicine and critical care at St. Paul.
they offer us to train our doctors, tuition-free training. And since then, up to now, we have enrolled, I think, around 140 doctors at the postgraduate level at the rate of 30 doctors per year. 36 of them completed, and they went back home, and they are now making difference in provision of the health services for our people. So this program is vital for development of human resource for health, which is the foundation of the health sector.
At the moment, we have the doctors who have come here for specialization. These doctors, so far, we have 60 who are here with us. Since 2015, we have graduated 36 doctors who are now already working in South Sudan in various hospitals. And at the moment, we have 60 who are presently here in Ethiopia, and 30 are coming in. So the total will be all 90. Out of these 60, some of them will soon be graduating, and then they will join their colleagues in the field. This is their scholarships that are given to the government of South Sudan. We are not paying any tuition fee for this. What was supposed to be given to them was just a little pocket money, especially the doctors. The doctors, because they don't stay in the dormitories. They rent their own places.
I've come across quite a number of professional doctors who are currently specializing in various institutions in Ethiopia. To me, this has been something that we need as a country, and I believe that would enhance our medical services back home when we have the right skilled people trained in very good institutions here in Ethiopia, gaining all the skills they need.
So we need our government also to support the students who are still currently abroad and those who are planning also to go abroad in terms of feeding, in terms of accommodation, and the other necessities, because you might get sick, you might need to come back for a trip, so air tickets and all these things are very important to be provided, and the current students who are there, they need also to be supported in that regard. The other thing also, when they finish, there should be a retention mechanism. Now, most of our graduates who graduated from Ethiopia are currently in the country, but still the retention policies are not well in place. And for somebody to deliver more, you need to have at least the basic necessities of life.
We should mobilize the fund to support those who are there actually, because the life there is need a lot of support in terms of feeding, renting of house, and so on.
The South Sudanese candidates who are studying postgraduate medical education or in various fields, they are doing well. Even if it is in a different environment, we deploy them to various higher learning institutions, giving residency programs or specialty programs throughout the country. Without hesitation, they do go to those institutions and they easily assimilate with the existing system and other Ethiopian candidates.
I think their performance, as I get it also from the various departments that they're getting their training, it's good. I think they have comparable involvement and practice and also engagement in the training system. The problems was, in fact, on the language. There is a language problem because the local language is Amharic and the other Ethiopian language. So, especially to communicate with the patients, there is some problem. But the colleagues or the students getting the training with them, they try to support them.
Most of the students from South Sudan, they spoke good English, and their capacity in terms of decision, communication, resolving conflict and so on, we found it very good. Actually, the mark was close to each other. Most of the students scored above 80, but we had to select the best 15. Otherwise, most could have been accepted.
Let me take this opportunity to one, appeal to the government of Ethiopia for more support in training the human resource for health. We'll be looking forward to be working with our colleague at the Federal Ministry of Health of Ethiopia to develop more human resource for health for the republics of South Sudan. I would want also to take this opportunity to appeal to the leadership of the government of South Sudan to support our doctors who come here, because this program is tuition free. We don't pay Ethiopia any money for training our doctors. We don't pay those universities, and they are in different universities. They are in Addis Ababa University, they are in St. Paul, they are in Gondar, Bardar, Adama, Hawassa, all the way to Mekele. They are there, our doctors. We don't pay Ethiopia for that, but as a government, we need to pay our doctors so that they are able to maintain themselves in terms of feedings and renting a place to stay.
We will continue, and there is a collaboration now, but we have to strengthen it. And as I said, in all sectors, not only in the education, the service, and also in research, doing research, collaborative research. So this is strongly supported by Addis Ababa University and also by your ministry. And I'm sure that's also supported by the South Sudan government and also the ministry. So not only teaching them, but also establishing specialty programs in South Sudan in the future. So we can also collaborate in that area.
For me, I would like people to embrace such initiatives, which I believe brings the concept of supporting each other into play. The role Ethiopia has done is take on the role of big brother for the region. So trying to help people from South Sudan, from Somalia and other countries is an indication of being your brother's keeper and trying to uplift the region as a whole. So for me, I would like the international community and the people with the ability to support such programs to join the different actors in making sure that we keep such interactions, such relations alive, making sure that we continue improving relations between the region, because it might not just end with just the studies. These students can one day end up working in any of the other regions, wherever the need is. So improving cooperation can happen through such programs.
COSEXA countries are about 13, including Ethiopia, South Sudan, Kenya, Uganda, Rwanda, Burundi, Zimbabwe, Zambia, Malawi, Mozambique. So we have, every year we have a meeting, okay, the COSEXA meeting. We meet with our colleagues from South Sudan. In that meeting, we discuss issues, okay, the progress of the surgical disciplines in South Sudan, the relationship between their colleagues, okay, colleagues from Ethiopia. So I think these forums are important, but it has to extend to like an exchange program. The exchange program would improve and improve their training, and also it is more economical than training 1-2 students in each hospital. So if you make it an exchange program, somebody trained in a specialty can go to South Sudan and train many general practitioners rather than some single person come to Ethiopia. Okay? That way you can improve the number of products, okay? The number of graduates from each discipline.
Ideally, all medical doctors are entitled to study postgraduate medical education or to join residency program in various fields. However, the training capacity of every country is limited. It's not only in Ethiopia, in all over the world, since there is mismatch with the demand to join residency and the available spot, to select the better ones to fit for the available space, examination is given. For example, this year, the available spot for this academic year, the available spots for in all Ethiopian medical schools is around 1,250. The applicants, including the Somalis, the South Sudanese, and all Ethiopians, are close to 6,000. So to choose those 1,250 fit ones, we have to compete among themselves, and those successful ones will get the spot.
So the government should have to have the quality, the infrastructures, and the faculties, and the quality of medical education. These are the most important things. And I know for sure, because I met the minister, the undersecretaries. I've been going to South Sudan now consecutively for the last 4 years, 5 years actually. So that, I mean, it is, they are very much willing to change the quality and then to make sure that it is acceptable standard. So that is the most important thing, and the government has to really, because that is where it comes first of all. And the second thing is, of course, the medical doctors, the graduates has to be as well making themselves professionals. It's not only that the government should have to push. I mean, the professionals has to be professionals. If they are not professional enough, they are not going to be accepted here. So it is two ways. So that, I mean, the quality of medical education with their commitment, and then they have to, medicine is always studying, so that they have to be professionals. So when the government and the professionals are coming together, obviously South Sudan will prevail and they just become the best.
So that is one of the problems that the doctors are facing here in Ethiopia. They don't have little money that can help them even buy something little, even for the rent. So these are the difficulties that are facing them here. But we hope that our government back home should look into this program. This program is very, very important. It can help. This training is a specialization in the various areas. And if we have the specialists in the areas that they are taking, it can help the country. It can help the country really. So despite the difficulties of financial issues that we are having back home, still the embassy here would like to urge the Minister of Health to work together with the financial institutions in the country to help these students so that they can be able to achieve what really the country needs them to achieve.
They have some problem with accommodation close to the where they are trained, okay, close to the hospitals. The other problem is language. Most Ethiopians in the market, they don't speak, fluent English. So that's what I heard. But still, financial and accommodation is a problem for them, and that has some, hindrance on their training. That is what I heard from residents in my department. But still, with all this challenging, they are competing with our students very well, and their score is not, at least I can say, good. Yeah.
Currently, we are facing a lot of challenges, that is including our financial upkeep here, and a lot of struggles that we are going through as students. Initially, we were sent here by the Ministry of Health with the program that they will be supporting us. But since we came, there has been no support in any form, whether it being financially or morally. We have just been here on our own, and we are also calling on our government that they should keep up to their word for sending us here in order to pursue our studies, because as per now, things are so difficult for us here in Ethiopia.
And so I'd want to take this opportunity to appeal to the leadership of the government of South Sudan to be able to pay our doctors. I know as a country we have been having some financial issues, some financial crisis, but moving forward and for continuation of this program, I think it is important that the Minister of Finance and Economic Planning cater for, give a special budget for maintaining and sustaining this training, which is vital for the health sector in the Republic of South Sudan, if we have to provide quality healthcare services to our people. So this is what I can say.
It's not only increasing the number, but we are also hoping to contribute to the quality health service in South Sudan. So one of beside the different infrastructure, the hospitals, is only when you have adequate and qualified medical professionals that you will ensure quality health service. So this is the basic objective. So in the upcoming years, as I said, it's not only taking students from South Sudan and train here, but we are also planning to open the program there in South Sudan. So the South Sudan fellows will start some of the programs based on the criteria that we will set together.
I informally met some of them last August, and they said they have complaints in terms of supplies, organizations, and so on. So to discuss those issues with the Ministry of Health of South Sudan and relevant bodies, I think that is a brilliant idea to follow them, to establish a sort of an association of South Sudanese alumni who have graduated from Ethiopia, so that we can work together, not only for the service, but also they came here and got trained as a specialist and returned back to South Sudan. They are giving service. Now, why don't they start residency program in South Sudan? So that's the sustainable way of resolving South Sudanese problem.
After we finished, we came back to South Sudan, and we are trying our best to implement what we gained. So this was a great experience, and it's also good for our colleagues who are still looking for ways of postgraduate study to have the idea of joining this residency program, because it's really beneficial and it will really help, because it's also like a free program. The Ethiopian government has taken an initiative of at least waiving the fees, the school fees for our students.
My message to the government consists of two things. First of all, for those who are still under training in Ethiopia, they are facing real challenges at the moment as we speak, in form of upkeep. Some of them are facing real difficulties in paying the rent and keeping their daily necessities. So my second is for those who came back. Most of us are here working as volunteers. We are not yet enrolled into the system. So also this thing need to be addressed, so people can work with enthusiasm and help the community of South Sudan. Because when we left the country to pursue our postgraduate studies, it's not just for ourselves, it's also to help our community and our people of South Sudan.
For us, we are training our people, and I just want to mention that as we build the human capacity, we need to also look at building foundational capacities in our country. The infrastructure for us is very weak, and I believe so long as we build our infrastructure as a country, we have more specialized hospitals, well equipped, these doctors without any doubt will give back to our country. So let's continue with this spirit of cooperation between us as one people in the region, and as our people go back, let's welcome them and accord them the necessary tools to help them now put that knowledge into practice.
For South Sudan, it is good to establish at least one excellent or tertiary center where specialists can be trained inland. Okay? Inland training is very different from training abroad. As I said, I was trained abroad. Okay? I went for vascular training to South Korea. So the hassle is there. I mean, there are economical issues, language issue is a problem. I tell you the truth. So if we establish a tertiary center in our own country, that can be a good training center. You can, instead of sending 2-3 people with a high budget, you can train in your own land with a small amount of money, a small amount of budget. You can train many people.
So this message also goes to the parents and the relatives who have their children, their relatives who are undergoing these courses in Addis Ababa, in Ethiopia. This message is need here to tell them that they should not be worried. All the South Sudanese students and also the diplomats in the embassy are doing well. And we will update them if there's any problem, but there's no problem at this moment. So all in all, that what we want to say is that the government should help. The Minister of Health should continue to support these doctors, and also the government of South Sudan should also support the entire group of students who are here, who are having different kind of needs that they want in order to pursue their program.
Having analyzed the remarks made by the concerned stakeholders in this documentary, one would only imagine the potentials of this program in improving not only the national health sector, but that of the region and beyond. It is therefore necessary to stress the importance of addressing all the challenges facing this project to find an amicable solution to ensure the continuity of this program. This documentary serves to lobby, advocate and campaign to encourage the government and the concerned sponsors to support this residence program. And as we conclude this awareness creation campaign here in Juba about supporting South Sudan's health sector, we'd like to put more emphasis about the importance of supporting South Sudanese men and women who have got opportunities to study in different institutions of higher learning through the support of Ethiopian government, Federal Ministry of Health, in developing the capacity of South Sudan's health sector. And it is on this note that we'd like to assure you and inform you that a healthy body creates a healthy mind, and a healthy mind is where creative ideas for development are formed. I am your host, Stephen Ugut, thanking you for watching this documentary.